Mr. President, today I rise on the heels of Mother's Day to bring attention to the health crisis facing America's mothers, most particular her Black mothers, and the Black maternal health crisis. I begin by acknowledging the invaluable contribution mothers make each day. Kissing scraped knees and chasing monsters out of the closet, Mr. President, mothers are indeed our nation's true superheroes. All across the country, mothers are the driving force for our economy. According to the Center for American Progress, mothers are to thank for most of the economic gains enjoyed by middle-class families over the past 50 years. Their data, covering 1970 to 2013, show that the women's increased labor force participation and increased earnings grew the U.S. economy by 13.5%, which translates to an additional $2 trillion in economic activity. And according to the Department of Labor, 40.5% of working mothers are equal, primary, or sole income earners for their family, a fact that is especially true for Black mothers. In the United States, Black mothers are a critical part of our labor force, and 80% of them are the breadwinners for their families. But, Mr. President, these same mothers face a healthcare system that is failing them. The United States has the highest maternal mortality in the world amongst high-income nations. Thousands of women in America have lost their lives due to pregnancy-related causes in recent years and over the past decade. While the birth rate in this country has declined by roughly 20%, maternal mortality rates have steadily risen. This crisis is exacerbated in communities grappling with the lack of access to essential maternal health care. According to a report produced by the March of Dimes, 1/3 of the counties in the United States are considered maternity care deserts, meaning there are no hospitals providing obstetric care, no birth centers, and no obstetric providers. Imagine your loved one preparing to give birth and bring new life into your family, having no choice but to drive hours away from home to seek care. We know from the data that this crisis has not been felt equally. Among Black and Native Indigenous communities, maternal mortality rates are 2 to 4 times higher compared to those of white communities. The good news is that champions in this chamber have spent years laying the groundwork in our path towards rectifying this crisis. In 2018, then Senator, now Vice President Kamala Harris introduced the initial Black Maternal Health Momnibus Act. The Momnibus, now led by the very own Senator Booker from New Jersey, is a comprehensive legislative package that would make historic investments to address every dimension of the Black maternal health crisis. I'm proud to serve as a co-sponsor of this much-needed legislation. The good news, Mr. President, is that since leaving this chamber, Vice President Harris has remained consistent and insistent in carrying these efforts forward into the Biden-Harris administration, spearheading the administration's blueprint to address the maternal health crisis. The blueprint has led to key actions involving innovative models to improve maternal health care for low-income women and a national strategy to address maternal mental health and substance use disorders. This blueprint, paired with the passage of thoughtful legislation proposals such as the Black Maternal Health Momnibus, are exactly what we need to combat this devastating crisis. As a member of this chamber, it's a privilege to truly be able to contribute to those legislative solutions and be a part of this fight. That's why I introduced the NIH Improve Act alongside Senator Katie Britt and Representatives Underwood and Fitzpatrick in the House to help address some of these disparities. The NIH Improve Act authorizes the funding necessary to sustain the critical activities of the National Institute of Health's Improve Initiative, which supports research on how to reduce preventable causes of maternal death, improve health for women before, during, and after pregnancy. The initiative aims to address the foremost causes of maternal mortality in the United States, as well as significant pregnancy-associated and pregnancy-related health complications, such as diabetes, obesity, mental health, and substance use disorders. This bill would provide the steady funding necessary, at least for the next 7 years, to ensure that NIH can continue to pursue this research into the root causes of our maternal mortality crisis. The bill will also help to build an evidence base to further improve maternal health care in underserved areas and target health disparities associated with maternal mortality and morbidity. Just one example of how the Improve Initiative is already supporting critical maternal health research is the story of a young researcher named Denise Mitchell, a doctor of public health student at Tulane University School of Public Health and Tropical Medicine. Through the support of the Improve Initiative, Denise and her colleagues are actively conducting pregnancy-related research to examine and eliminate maternal health disparities and ultimately reshape communities in need. Specifically, their research examines strategies to support healthy eating and increased physical activity among low-income postpartum women with a history of diabetes during pregnancy, one of the many conditions associated with maternal mortality and morbidity. Denise has said that the NIH-funded studies such as this have transformed her educational experience and catapulted her professional aims as a training research scientist. In addition to serving as a doctoral research assistant, Denise is also a Black mother. Denise is a manifestation, a real-life example that Black women, Black mothers, and all mothers are so much more than just a statistic. They are vigorously working towards solutions that we need to improve maternal health outcomes in this country. The urgent research efforts called for and outlined in the NIH Improve Act and initiative will not only help to address our nation's maternal health crisis, they will also help to support the next generation of Black mothers, scientists, and leaders such as Denise. The life-saving research supported through the NIH Improve Act will bolster solutions that are designed to combat the crisis that all women are facing. Mr. President, I'll close with this. In the majority opinion of the Dobbs decision that essentially ripped away the reproductive freedom of women and that they had fought for nearly 50 years, Justice Alito wrote, and I quote, "Women are not without electoral or political power." While I disagree with most of what Justice Alito wrote in this opinion, on this point with him, I do agree. The political and electoral power of women in this country demand the health care that we need, demands the health care that we deserve. Advancing the NIH Improve Act will serve as a key step towards accomplishing that. And so while I serve in this chamber, I will continue to push and to push us to deliver the investments required to address this crisis head on. I'm committed to seeing this through for my daughter if she decides to become a mother, for every woman who chooses to be a mother, and for the future of the nation that they will shape. Thank you, Mr. President. I yield the floor.